And today we're going to take a look at the phased reopening plans that are underway in DC, Maryland, and Virginia. And we're really fortunate to have our guests with us today, who are going to help us understand what's going on. Eugene Kinlow, the Director of the Office for Federal and Regional Affairs from the Executive Office of the Mayor of the District of Columbia. We have Kelly Schulz, Secretary, Maryland Department of Commerce. Angela Navarro, the Deputy Secretary of Commerce and Trade for the Commonwealth of Virginia. I would note that all three are also participating in our Connected DMV Regional Economic Recovery Task Force, and we thank them for assisting with that. And moderating our discussion today, we have Roy McGrath, who's currently the CEO and Chairman of the Maryland Environmental Services Board of Directors. I will note that Roy is only going to be in that position until next week. He was recently appointed Chief of Staff for the state of Maryland by Governor Hogan, and so we offer our congratulations. Roy, certainly an interesting time to be starting a new role, and particularly that role, but we're all very excited about the opportunity in working with you as we get the region back to work. If anyone has any questions during this, please use the Q&A at the bottom. That's been working very well. We'll get to as many as possible. This session will be recorded and shared on our website later this week in case you missed something. And so with that, now I want to turn it over to Roy, who's going to provide just a quick, some remarks to set the conversation, introduce our guests, and then we'll get started. And so with that, thank you again, everybody, and thanks, Roy.
Thank you, Jack. Good morning, everyone. First of all, let me just say to the Greater Washington Board of Trade, thank you and your team so much for bringing together this very timely and insightful webinar series, including today's session on the planned phased reopening. I certainly appreciated the invitation to moderate today. When I accepted, I wasn't anticipating transitioning into the new role that you mentioned, Jack, but I do want to say at the outset how much I value the work and the organization that's done by your outstanding team at Board of Trade. As many are surely aware, Maryland, Virginia, and the District of Columbia are each developing phased plans for reopening the economy in the wake of the COVID-19 crisis. As we transition from different variations of stay-at-home plans to the more recent safer-at-home orders, regional plans continue to be developed for easing business and social restrictions. And what these plans look like exactly and how they're ultimately implemented is fluid and certainly a work in progress across the region. So on today's call, we're going to hear more from the panel of distinguished experts that you mentioned, Jack, about the regional approach across the DMV to how our jurisdictions are approaching this challenge and what phase one might look like in each jurisdiction that hasn't moved there yet and across our region. And certainly I think while regional approaches may differ slightly, there are certain underlying principles that remain the same for moving forward, decreasing in the number of new cases over a period, corresponding increases in hospital capacity, expanded testing capability, availability for our emergency personnel to have sufficient PPE, and certainly robust contact tracing programs. There are also, I think, many examples of local and regional collaborations that have helped to move the needle during the pandemic, including the Chesapeake Bay Agreement, partnership with Delaware and Virginia on poultry issues, the Menhaden letter with Virginia, WMATA funding, and there's certainly many more that I won't touch on yet today. And while we're primarily focused locally and regionally, reopening plans are certainly being developed or underway across the nation, and there's many learning opportunities that are coming out of these varied approaches and results. So additionally, there's some unique and powerful ways that I think Greater Washington Board of Trade members are navigating this crisis and our region's return to more normal operations. You've likely been reading about some of those by email sent out by the Board of Trade. And to help guide these efforts, the board's taken on a very important role as a strategic host for Connected DMV, which is a wide-ranging cross-sector effort to generate economic development and to drive regional collaboration. It also offers a very timely and valuable venue to collaborate on crisis management as we all continue to collectively navigate COVID-19 together. So with that brief introduction to today's topic, I'd like to take a few moments to introduce our esteemed panel. I'll start with, take a little personal privilege here and start with my colleague from Maryland, Secretary Kelly Schulz. The Honorable Kelly Schulz serves as Secretary of the Department of Commerce, where she brings a wealth of knowledge from her years of experience working in government, the private sector, and as a small business owner. She previously served in the Hogan administration as the Secretary of the Maryland Department of Labor, Licensing, and Regulation, and she's also a former member of the Maryland House of Delegates. At the Department of Labor, Kelly was responsible for managing an agency of nearly 2,000 employees and an operating budget of more than $375 million. As a former member of the Maryland House of Delegates representing Frederick County, Maryland, she served on the Economic Matters Committee from 2011 to 2015. And prior to embarking on a career in public service, Kelly Schulz sold real estate professionally, working as a program manager for a defense contractor and was also a part owner of a cybersecurity firm. She's completed an associate's degree from Monroe Community College in Rochester, New York, and later obtained her Bachelor of Arts in Political Science from Hood College in Frederick, Maryland. So welcome to my friend Kelly Schulz. I'll turn next to Eugene Kinlow. Director Kinlow serves as Director of the Office of Federal and Regional Affairs, OFRA for short, for the Executive Office of the Mayor. Prior to joining the Bowser administration, Mr. Kinlow served as Senior Strategist for Dragon and Unicorn Strategies, where he facilitated conversations and created community engagement strategies for nonprofit partners and the business community. As a public affairs director for DC Vote, he strengthened relationships with elected officials, community members, and coalition partners in an effort to bring full voting representation to the residents of the District of Columbia. Mr. Kinlow was the former vice chairman of the Consumer Utility Board, and he is a past member of PEPCO's Blue Ribbon Panel on Reliability. He's a native Washingtonian and received a Bachelor of Science in Business Administration from the University of the District of Columbia. Welcome, Director Kinlow. And finally, and certainly not least, it's a pleasure to introduce Angela Navarro. Ms. Navarro serves as Deputy Secretary of Commerce and Trade for the Commonwealth of Virginia. She previously had served as Deputy Secretary of Natural Resources under both Governor Northam and Governor McAuliffe, where she focused on energy and clean air policies. Prior to her appointments, Ms. Navarro spent 5 years practicing law with the Southern Environmental Law Center as a member of the Clean Energy and Air Team. While at SELC, she also led the organization's energy efficiency practice across a 6-state southern region, and she was the organization's lead attorney on energy matters for Virginia. Secretary Navarro holds a business degree from the University of Florida and a law degree from Georgetown University. So welcome, Secretary Navarro. Let me just dive right into this important conversation. And I think a great place to start is around regional collaboration, since that's really Greater Washington Board of Trade's focus. So maybe we could begin with the question, how are the leaders in our region working together? What are some of the decisions and challenges you're all facing? And how often are leaders meeting and talking and strategizing together? So maybe in no particular order, Director Kinlow, could we start with you?
Sure. And congratulations, Roy, on your new position. I will look forward to working with you in the Office of the Mayor in the region. I want to thank Jack and his team at the Board of Trade for scheduling these conversations. I think they're extremely helpful for the region and for the nation. I think regionally we are in a very good space in terms of the relationships that our principals have with each other. Governor Hogan, Governor Northam, and Mayor Bowser, they connect. While I can't say frequently, they do have time to pick up the phone. They find themselves on the same conversations. And they find themselves being like-minded about the priorities of the region, whether it's transportation, moving a workforce in and out, and the effect of COVID-19 on that particular workforce. I am knowledgeable of at least 3 communications that the governors and the mayor have put together after having a brief conversation about what can they do collectively. In March, around March 23rd, they sent a letter to, I want to say it was OMB, on a regional coordination with the federal government and whatever happens, whether it's telework policies, whether it's about making sure there's some sort of coordination with the federal government. And I think that was an extreme sign of leadership on their behalf, not the federal government saying, this is what I need you to do, this is what we are asking you to do, federal government. In April, they followed up with another letter on urging the federal government to institute and reinforce telework policies. I think that before this pandemic, nonprofit, for-profit, business, government, we had telework policies, but they weren't fully flushed out in terms of what would be required to get people there, the equipment, the infrastructure, the policies. So the governors and the mayor put together and penned a letter urging OPM, the Office of Personnel Management, to be engaged in a thoughtful process. And as you can tell, a lot of the federal government is teleworking. And the question is, well, what will those policies look like moving forward? And I believe last month they communicated again on federal funding for testing for this region. If this region has House and the Senate, our congressional leaders, our federal leaders, it's important that we maintain the strength of this region so that we can continue. But aside from those conversations, there are also additional conversations that they're part of. The White House calls with the governors, and I think there's probably been at least about 15 of those calls to date, almost one every week. The mayor, though she is not a governor, she's had an opportunity to engage with those governors and with, of course, Governor Hogan, who's the chair of the National Governors Association. So they've been able to I think about some of the best ideas and then push them forward.
Thank you, Director Kinlow. Maybe I could turn to Deputy Secretary Navarro if you have some thoughts on this topic of collaboration.
Sure. Well, thanks, Roy, and thanks, Eugene, for kicking things off. I'll certainly echo a lot of the words that were already mentioned relative to teleworking, transportation. Obviously, we share some very significant interests around the federal workforce. So the conversations that are ongoing with the federal government around that aspect as well. One thing that I'll say, just as we've been thinking about our phased approach, especially with Northern Virginia, the proximity to DC, and to Maryland as well, is sort of thinking through how we as a Commonwealth would move into various phases. So when we announced that we would move into phase 1, for example, we did grant a delay for Northern Virginia in terms of moving into phase 1 so that it would be more in line with some of the policies that were being discussed in Maryland and DC. So there would be consistency amongst individuals who might live in the district and work in Northern Virginia or live in Maryland and commute across state lines. We wanted to make sure that there was some of that consistent effort occurring. And a lot of that happens through, as Eugene mentioned, the dialogue between Governor Northam, Mayor Bowser, and Governor Hogan. And certainly with Governor Hogan as the chair of the National Governors Association, doing a lot of that interaction through the governors has been particularly helpful as well. There certainly is a lot of coordination going on the health side, as Eugene mentioned, around testing, procurement of resources, PPE, even the Patel disinfection device, which is now being utilized across DC, Maryland, and Northern Virginia for the disinfection of PPE materials. And then just wearing my commerce and trade hat, we've always worked really well across state lines with the Board of Trade and with other regional entities around economic development priorities. I worked on the Amazon proposal, for example, where we submitted joint letters with DC and Maryland relative to that enhanced economic development opportunity, recognizing that that would bring significant new jobs and revenue to the entire region. And coming out of COVID, as we're all thinking about our economic recovery plans, thinking about ways that we can stimulate the economy, especially as we're looking to the DC metro region, which has such a heavy focus on the tech sector. I think that we'll be doing a lot more coordination going forward. So just looking forward to continuing the dialogue.
Wonderful, thank you. And I turn to Secretary Schulz now as well for this collaboration question topic.
Sure. Thanks so much, Roy and Jack and your entire team for putting this together today. It's very much appreciated. Hello to my counterparts to the south in both DC and Virginia. It's great to hear both of you today. I think that there was a lot covered as to what has been done throughout the entire process, both going into the beginning stages of shutting things down, and now as we move into the recovery phase, and understanding that our region is a little bit distinct from other regions around the country, whereas we do have a lot of cross-population between living arrangements, working arrangements, and lots of activities and outdoor activities, et cetera, that people really do look at the DMV as, you know, their home areas. And so the borders are kind of fuzzy sometimes. So this is an important conversation. I will just say, in addition to what has already been said about the NGA meetings, which is really important, and we're very blessed to have Governor Hogan be the chair of the NGA, and I think it has helped all of us to be able to move forward in a cohesive manner. But I also want to just acknowledge the Greater Washington Board of Trade and Jack specifically on putting together the task force, the DMV Strategic Renewal Task Force. And we had a first meeting just last week, and I know we're going to continue to move through that. And I think very important topics of conversation are occurring, not just between those of us that are in the public sector, but also those of us, our partners in the private sector, to talk about different ways of moving forward. So I look forward to continuing conversations. I know that all of my counterparts also within other agencies are looking forward to what this renewal means to them as well, because it's not just a Department of Commerce and Economic Development issue. The recovery is going to be very widespread amongst all subject matters.
Secretary Schulz, that's probably a great transition to our next question. So I'll stay with you if I might. Certainly all three of the jurisdictions are planning for a gradual phased reopening process where we move to the next phase if the right public health criteria have been met. As of now, none in the Greater Washington region have yet moved beyond phase one. Can you describe a little about the criteria we need to meet and how the administration is measuring progress and how progress is going?
Sure, absolutely. So in the state of Maryland, we use the criteria and we really use the AEI report that was drafted by Mr. Scott Gottlieb over at AEI, who is now working on the governor's recovery team as well. But really what those guidelines outlined was a phased-in approach, which I believe everybody across the country is utilizing in one way, shape, or form. So Maryland was going to move into phase one if it met very specific criteria. And that criteria was what the governor had called his building blocks. And he had 4 building blocks in order to be able to work off of, which included, amongst other things, increased testing, an increased number of hospital beds, contact tracing capabilities, and an increase in the amount of those critical need items like PPE, ventilators, et cetera. So once we got to the point where there was an increase in those types of criteria, the governor's 4 building blocks, in addition to a downward trend in the hospitalizations and ICU admissions, then the governor felt comfortable to move into that first phase. And as we move forward into phase 2 and phase 3 in the state of Maryland, we'll be looking at a 14-day window in order to be able to make sure that that increased social togetherness, now that we're opening up to some of those lowest of risk entities as far as the recovery is concerned, we'll be looking at that 14-day trend to continue in a downward fashion.
Thank you. Director Kinlow, I think we have some breaking news on this topic in the last few minutes in Washington, D.C. Would you like to elaborate on this question as well?
Sure. And before I talk about what we're doing in Washington, D.C., I just want to say I'd be remiss in when you talk about regionalism, not to discuss the strength of the region politically when you talk about the House and the Senate and the conversation that they're having, not just on behalf of what happens in Maryland, whether it's Steny Hoyer or Warner for Virginia, but for the region. And so we've got a strong leadership team on Capitol Hill that continues to advocate for us. And another organization as well, the Metropolitan Washoe Council of Governments, has done a great job of facilitating the conversations and processing the thoughts that just transfer throughout this region and through the state governments. But to the breaking news, just a little while ago at 11 o'clock, the mayor made an announcement about our opening posture. We're moving into phase one. She announced that this Friday we will begin that transition. The mayor is actually still at that press conference, and for those of you who'd like to see it, if you're in Washington, D.C., it's on channel 16. But if not, you can follow many of her pronouncements today at coronavirusdc.gov. She just announced a number of sweeping efforts that would move us into phase one. We've always been guided by the math and the science around our reopening strategy. I think many jurisdictions, and I take great pride in understanding that Johns Hopkins is here in the region as well. And many jurisdictions are looking at some of the documents that they've created in terms of this virus and next steps as a significant guidance document. Well, the mayor's effort to reopen Washington, D.C. starts with a 14-day decrease. And the mayor indicated this morning that most likely by Friday we would have seen those 14 days. I'm not sure if it hits tomorrow, but she has announced that on Friday we will be in reopening posture. The rubric that was set out by Johns Hopkins and other institutions, I mean, the National Government Association put out a rubric as well, talks about testing capacity, be able to make sure that you're testing those who are symptomatic. Also talks about health system capacity, making sure that we've got the capacity in our hospitals and we're meeting that and that those systems are not overburdened. In addition to that, I think one of the last pieces of evaluating that was where we would be in our testing capacity and testing and tracing. The mayor announced that on June 1st, our first cohort of contact tracers would have fulfilled their first, they would have fulfilled all their training obligations, and we would have our first team out on the street. I think that the goal was to initially go to at least a couple of hundred contact tracers and getting up to a team of probably about 800 or 900. A lot of those steps have been met and we are moving forward. Now, of course, phase one looks a lot different from phase two and phase three, but we are happy to be be moving forward and understanding that our health posture, we believe that we're continuing to reinforce the message through public service campaigns on being safe, wearing masks, washing your hands, and socially distancing yourself from others while you're out. But I think this is good news. I don't have all the details, but I'm actually monitoring the press conference while we're on this call as well. I'll pull a few of those pieces out and share.
Wonderful. Thank you. I know all of us become professionals at multitasking, so I see you're putting it to good use. Maybe I could go to Deputy Secretary Navarro with the same question.
Sure. So I echo the words that Eugene and Kelly said relative to the CDC guidelines and really relying on the CDC guidelines as we're moving into phase 1. So the governor announced that we moved into phase 1 for most of the Commonwealth on May 15th. As I mentioned, Northern Virginia, Accomack County, which is a county on the Eastern Shore, and the city of Richmond were delayed for 2 weeks. And that 2-week period would expire this Friday. So we're certainly having conversations with those jurisdictions right now about the data metrics. The data metrics that we're utilizing, I reiterate the words of my counterparts in Maryland and DC, we're really relying on the expert guidance from CDC, the Hopkins report that Eugene mentioned as well. We have 5 key metrics that we're tracking and monitoring every day with our health team. The percent of positive COVID-19 cases, hospitalizations, seeing declining trends in hospitalization rates for COVID-19, looking at intensive care capacity and hospital bed capacity across our hospital systems, supply of PPE, which of course was a challenge early on as we were dealing with the pandemic, but we've certainly been able to address that much more comprehensively. And then testing and contact tracing, which moving into phase 1, and now as we're looking at moving further into phase 2 in the coming weeks, that ramping up the testing and contact tracing will continue to be of principal importance for us. So those are the big metrics that we're utilizing. Our phase 1 really was a light touch aimed at ensuring that we were getting consistent data and results as folks start to venture out. Our stay-at-home order ceased and we went into a safer at-home strategy. Really focused on outdoor activities, outdoor dining, outdoor exercise, sort of making that the new normal as we moved into phase 1. Looking at phase 2, I think we'll start to see some expansions in indoor environments as well. And then the other announcement that the governor made this week, in addition to looking at moving into phase 1 for some of our jurisdictions that are not in phase 1 yet, is yesterday he signed an executive order requiring individuals to wear face coverings in indoor locations. So that includes shopping centers and pharmacies, banks, when you're waiting to get your oil changed. So lots of those sorts of situations where it was recommended previously, but now as we move to expand different sectors of our economy, opening up more sectors, the face coverings will be an important component of that.
Thank you, Secretary. And you mentioned contact tracing in your remarks. I want to stay with that for just a moment and pose a question to all of our panelists. Certainly contact tracing is regarded by public health experts as one of the key elements in mitigating this health crisis. How, maybe just a brief answer on how your administrations are setting up your contact tracing programs and importantly, collaborating regionally on them. Please go ahead, Secretary. If you
Sure. So I'm happy to take the lead and then others can fill in. So this is an effort that's being led by our health team at the Virginia Department of Health. We basically have project leads. These are individuals who have a deep level of expertise on doing the contact tracing, and they're building out teams both regionally and statewide to ensure that we have adequate levels of contact tracers across the Commonwealth. We're looking at over 1,000 contact tracers as we continue to move through phase 1 into phase 2. So VDH is working, our Virginia Department of Health is working right now to vet candidates to do that hiring. We have a broad team inside VDH that's doing that work, and they're certainly working with the private sector, with staffing agencies, and with the governor's chief workforce development advisor, who's helping to sort of develop the outreach tools to ensure that we get the level of qualified applicants that we need to do this work over time. We know that every state is sort of wrestling with hiring a large number of folks in a short period of time with a very intensive scope of responsibilities that those individuals have. One other thing that we've done to complement the contact tracing is our Medical Reserve Corps. So we've got tens of thousands of folks who have volunteered to serve in our Medical Reserve Corps. These are doctors and nurses and pharmacists and people who have a medical background but may not be utilizing it directly in COVID-19 response. And a lot of those individuals are helping to do some of the questionnaires and the interviewing through the contact tracing process. So that's another element, a leg of the stool, if you will, that's helping to support the overall effort.
Thank you. Secretary Schulz, can we pose the same question to you?
Sure. So obviously everything that Virginia is doing in the intensive contact tracing is actually what we're doing, also being led by our Maryland Department of Health. And obviously the contact tracing, it really is that process of identifying those who infected individuals have come in contact with this very infectious disease. And so the process involves many people identifying infected people, determining who they've been in close contact with while infected, and asking people who are potentially infected to stay home until it is clear that they had not contracted the disease. So working very closely with that criteria as one of the governor's 4 building blocks, Maryland has contracted with NORC, which is out of the University of Chicago, and it's one of the largest independent social research organizations in the United States. And so contact tracing programs will be facilitated by NORC in coordination with the Department of Health and our local departments throughout the state. Currently, Maryland has more than 1,000 tracers statewide to track more than 1,000 cases and 10,000 people daily. So we're looking at everything from obviously trying to protect and adhere to strict HIPAA regulations, but also making sure that we identify those prior to a continued spread, which is obviously one of the conditions of moving between phases of recovery.
Thank you. Director Kinlow, thoughts on contact tracing from the district's point of view?
Okay, I mentioned that our first cohort will come out of training in just the next few days by June 1st. We have about 65 contract tracers right now, and 70% of our cases have already been traced. But we realize the importance of making sure we've got a robust team. We realize as testing increases, the numbers will increase, and we need to be able to trace everyone as best as we can. The contract trace force, they have a 5-step process. And the first is testing, isolating, testing 1, isolating 2, tracing 3, 4, quarantine, and 5, connect to services. So I think that through our Department of Health, we've got a process that's similar to the other states. It's my understanding that each jurisdiction has a different vendor with probably a different methodology, but it's our hope that at some point, and I know that the governors have had a conversation on this, on contact tracing, that on contact tracing, that there's an opportunity for them to connect the dots a little further, because there are people who work in Washington, D.C. and live in Maryland and worship in Virginia. We're all connected, so we're going to be crossing each other's borders. So it's going to be very important that we share information and share information to services in each jurisdiction for those who are affected.
Thank you. I'd like to turn a question to both Secretary Schulz and Deputy Secretary Navarro. Both Maryland and Virginia have areas that are heavily populated and other areas that are not. Can you share a little bit about how the respective administrations have been tailoring orders, regulations, and guidance to address the different needs of these communities? Secretary Schulz, maybe I could start with you.
Sure, and thank you for that question, Roy. And I think from what I have understood, and I think we all sit on some of our SEED calls, the State Economic Development Executive calls. So I'm grateful for getting some information about what's happening around the other states across the nation as well. And looking at this issue specifically, there has been, similar but different types of reopening and recovery strategies. In Maryland, the governor had put a statewide precedent on phase 1 and said that the state was going to lead the way to open up the entire state based on very specific best practices and criteria in those specific industries that were given the benefit of reopening during phase 1. However, he left the question of specific jurisdictions, the 23 counties and Baltimore City, to determine if they felt as if their jurisdiction was ready to be open and if they were comfortable with what they had as far as their metrics were concerned to be able to open. So what we saw is that there were several counties and Baltimore City who either restricted all opening in phase one or had less or more restrictive guidance than what the governor had put forward. So it was really those densely populated areas that took that opportunity to be able to say, we want to pause on phase one for a little longer period of time because our numbers were rising or they had not continued to trend downward, or they did not feel as if they had enough of the different criteria that could be able to help, whether it was PPE or testing or one of those building blocks that was important to those jurisdictions just because of the large population in those jurisdictions. And since those periods of time, I believe that many of those jurisdictions are re-examining due to the increased amount of testing, for example, where we were able to get some more facilities set up, and I think some more are being set up this week as we speak. So they could be more restrictive than the state, but they could not be less restrictive than the state.
Thank you, Secretary Schulz. Secretary Navarro posed the same question to you, this topic of urban versus rural considerations.
No, Roy, I appreciate the question. It's incredibly timely, of course, because we're thinking about this even as we're moving into phase one for Northern Virginia, which is on a different trajectory than some other parts of the state, including our rural areas. The track that we've taken is very similar to what Secretary Schulz laid out, where we're setting the floor, the baseline of what phase one looks like. And the health data is really guiding when various parts of the Commonwealth will move into phase one. And that's really how we'll be looking at this phased approach going forward as well. I will say at the outset, when the governor first issued Executive Order 53, which is the order that started the process for stay at home that restricted some business operations, we really tried to do it in a very measured and thoughtful way to address those sectors where there was the highest risk. But while really providing guidance to businesses across the entire Commonwealth, whether it's a rural business or an urban business, about best practices and measures that they should be implementing, recognizing that this is going to be a process that will continue to unfold as we move through the various phases. And then while we were putting together our phased reopening strategy, we utilized a business task force that included both large businesses and small businesses from every corner of the Commonwealth, including rural jurisdictions, suburban jurisdictions, and urban jurisdictions, recognizing, to your point, the nuance of business operations depending on who you're catering to. And that really helped to shape the guidelines that we developed in our Forward Virginia plan, so that they would be flexible enough that a business in rural Virginia could implement those practices just as well as a business in urban Virginia. I think the timing, as Secretary Schulz mentioned, is really the one area that might differ from our rural and our urban jurisdictions. We know that the rates of transmission have been higher in higher density locations like Northern Virginia and the city of Richmond, which is why we said they could delay moving into phase one based on the public health data that they were seeing in those jurisdictions. But we're setting the baseline, we're setting the floor that every part of the Commonwealth will meet. And that is based on giving businesses the flexibility to ensure that they can meet those requirements. And then as we move forward through the phases to come, each of the phases will be the floor, and then the businesses will adapt based on that. And some of those jurisdictions might say, we're not quite ready to move into that phase yet because our public health data isn't quite there, just as Northern Virginia and the city of Richmond have done. And we'll evaluate those requests as they come in moving forward. But that is a very similar approach, it sounds, to how Maryland is taking this as well.
Great, thank you for those helpful insights. I've noticed questions coming in from our audience, so I think it might be a good time to take a pause and let me turn it back over to Jack McDougal for Q&A.
Roy, hey, thanks. That's great. Yeah, so we've had a few questions come in, so I wanted to share those with everybody and have some conversation around it. One of the issues that gets brought up an awful lot is around, during the various recovery phases, how do we restore public confidence and trust? How do we make people feel safe to go back out and and engage in all sorts of different types of activities. And so, Eugene, maybe we could start with you and go back to contact tracing, for example. Contact tracing is talked a lot about being one of the essential tools that we need to manage public health. But there's also a lot of concern about contact tracing from a privacy perspective, a data perspective, how the data is being collected, how is it used, and so if I could ask all of you to talk a little bit about, what are the safeguards that are being put in place, how are we managing that data, and how are we doing so across jurisdictional lines?
All right, tough question, but and I think that you've highlighted that this is a public health emergency, but it's also it's a communications, how do I say it? This is a communications crisis, and we have to be able to communicate to people well about our understanding of the disease and what's required of them. So I think one of the best things that we can do, one, is just continue to reinforce those positive notions of what is expected during this crisis. Many of these things, contact tracing, wearing masks, we're all unfamiliar with it, or at least, looking a year into the future, we'll look back and say, oh, that's common sense. And we did it, and we operated within the rules and with a good sense and with good judgment. Right now, so close to the incident, a lot of people are still confused. A lot of people still don't know who the right message bearers are, and if they're getting the best information and accurate information. It's up to us, one, to communicate, over-communicate about what people need to do in terms of how are you feeling, how you should get tested. And one of the things that I think that we did well, or which has been, I think, extremely helpful, I don't have the numbers of the polling, but Mayor Bowser reached out to former First Lady Michelle Obama to create a series of public service announcements. One, to raise awareness of this disease, is to make it serious. When the First Ladies, through robocalls, through ads, through a virtual presence on websites, is reinforcing this is serious. Stay home, stay home, stay home, distance, wash your hands. And those sort of pieces are all elements of a communications plan that needs to rest on top of and beside of any other strategy. Yeah, there are some privacy issues, but public health, when you're dealing with the public health, there are broader powers that can be brought to bear, because you don't need someone who's positive to infect a larger community, and the jurisdictions have to do what they need to do to tamp those down.
Angela, do you have any thoughts from Virginia's perspective around, particularly on this particular issue around data, and how do we reassure people how it's being used in this case?
Well, I'd actually like to start by touching on the public confidence question that you started with, because
Sure.
That's a huge area of focus for us. And it's something that we've always said. The governor says this in a lot of his press conferences, that the way that we rebound and recover is through businesses and consumers, getting the confidence of businesses and getting the confidence of consumers. So that really starts with ensuring that we're guided by data, that we're guided by the public health metrics, that we're putting the mitigation measures in place that will make these environments safer, recognizing that nothing is 100% safe, but these mitigation measures are ensuring that individuals, when they do go into these places of business, that we're taking every possible precaution for them and for the employees in those locations. So really being clear, as Eugene mentioned, on what those expectations are, how we can protect ourselves and how we can protect each other. I think that's a really foundational level for all of this. And that's really what these guidelines that all of our jurisdictions are preparing, that's what these guidelines are really aimed at, is making sure that there's a baseline level of understanding when you go out into the marketplace, when you go to the grocery store or to the bank, what your expectation is and what that business will be doing to make sure that you're remaining safe as well. The question about data, of course, is a fundamental question that crosses not just during the pandemic. It occurs in everyday life when you're dealing with sensitive governmental information. So we have a number of important safeguards in place, from the cloud management technology that we utilize to data privacy measures that we implement. We have statutory requirements, we have federal reporting requirements. All of that is aimed at ensuring that the sufficiency of our data remains confidential, that individuals' sensitive public health information remains confidential. When we reveal data, we do it in an aggregate basis so that it does protect the identity of individuals. We purposefully do it that way. Obviously, it's required by law, but we also want to ensure that individuals feel comforted in knowing that their data is going to remain secure.
Great, thanks. Yeah, I mean, this whole notion about, communications and messaging, and one of the things that's been really challenging, I think, through this, and Eugene, you pointed this out too, is that we're learning every day, so there really isn't any guideposts for this. And so I do think that, both from a business perspective and a public sector perspective, just a heightened level of responsibility to make sure that we are very clear and transparent in how it is that we're communicating. Kelly, in Maryland, how are you all thinking about in working through issues around, communication and restoring the public trust?
Yeah, well, so obviously, you're right. None of us have lived through this before. Hopefully we won't have to again. But really, I think every single one of us understands that in any type of a crisis, which is what we're in right now, both health and economic, communication is the key, right? So being able to make sure that the general public is really understanding of everything that we're doing. It can be somewhat challenging in good times, but obviously at this point in the juncture, just making sure at some point in time that misinformation doesn't get out to the public as well. And that's, just as difficult as getting the message out. And it just continues to be, an uphill battle. But in the state, we have put together a multi-agency communications team that's led by the Department of Commerce, Maryland Emergency Management Agency, the Department of Health, and others in order to be able to start to determine what some of those public service announcements can be in the future as we move through the different phases of recovery. But also, it was really important to us when we, at the Department of Commerce, built our website for information. It's a back to business website that we just created, in the course of the last 2 months. And it really is a great vehicle to put information out there to the public, and obviously pushing information like that out through social media and other means is very, very helpful. Every time the governor mentions it in one of his press conferences, we get thousands and thousands of hits, which is really important because people need to know where to go to get this information. And it's not just the businesses that are using this, it's also the general public that's looking at those very specific industry groups and the best practices that we've posted on that website so that they know what the requirements are that we're looking for businesses to utilize when they start to have their safe opening. And it has been very important. We have 13 advisory groups at the Department of Commerce, very industry-specific groups. And so that they were able to participate in what the reopening strategies would look like, obviously based also on CDC guidance and Maryland Department of Health guidance. But having them be a part of that process has helped to get their sense of understanding that the state is, there to help and all of that. But as importantly, it's important for the employees and the general public to know what that guidance is as well, so that they know that it will be at some point in time safe to go back and continue economic recovery throughout the state, knowing what the guidelines are to go into a small retail establishment, for example, and what an employee needs in order to be able to go into a manufacturing environment. So we took all of that very specific best practice information, and we built a back to business pledge in the state of Maryland, and businesses can download the back to business pledge and sign it and post it in their place of employment. And our thought is that the business owners really need a way for them to also communicate very openly with their employees and their customers that they are following a certain set of guidelines that they make every single day, and that they're going to continue that every single day. and to build that confidence that's out in the public. And we've had thousands and thousands of downloads of that Back to Business pledge. And businesses are really utilizing that to advertise the fact that they are a safe and healthy work environment.
Okay, great, thank you. So, so we've talked a lot about guidelines and providing that guidelines, and I know we're still in the process across the region of developing those out. So where are we in that? I mean, do we expect that we'll have guidelines in place and communicated, you know, starting, I mean, some of it's already starting now, but even as we drill down into more detail, you know, what else is coming? What else can the business community expect? And then how are you all thinking about compliance with regards to these things? Once the guidelines are out there, is it sort of up to each business or each community to think about how they're going to comply? Will there be inspections in place, for example, to make sure that, you know, restaurants are complying? And you know, so what aspects of the guidelines can we expect to come into play, and how can that help reinforce the public trust and confidence again too? Maybe Angela, we'll start with you, and then Eugene and Kelly.
Happy to. So we already published our phase 1 guidelines. They're on the Forward Virginia section of the governor's coronavirus website. We have general business guidelines that apply to every sector. That could be a manufacturing operation or a call center or a traditional office environment. We also have sector specific guidelines for certain sectors where there are high touch, high frequency of public engagement. That includes brick and mortar retail, personal care and personal grooming. There's guidelines for farmers markets. We'll keep adding to that page as we move into the various phases. So as additional sectors begin to reopen, and we'll continue to expand upon those guidelines by adding additional sectors. But those guidelines that you see in phase 1 will continue to be the foundation. The issues that we might be grappling with are things like capacity limits, expanding the capacity in certain operations, things like that. The other side of this is your question about compliance. So yesterday, when the governor issued an executive order requiring individuals to wear face masks in indoor settings, certain indoor public settings, he also directed the Department of Labor and Industry, which is one of the agencies within my secretariat, to develop emergency regulations for workplaces. And that's really to codify some of those same requirements that are already in the guidelines. They will be provided to our board. The board will have to review them and approve them before they become finalized, but then the Department of Labor will have an individual opportunity to determine compliance with those guidelines. Right now, compliance is determined by the Department of Health under a public health order, but that will also expand once those guidelines are finalized. They'll become part of DOLE's code. And then the Department of Labor and Industry, DOLE, will be able to enforce them. The timeline as yet is a little undetermined. The board will have to meet and review them. We think that will happen at some point in June. And certainly they'll have to provide that draft for the public review before the board reviews them. So that's part of the process that will be moving forward. And that's really to codify some of the requirements around wearing face masks, enhancing cleaning and disinfecting, ensuring additional workplace safeties are provided.
Okay, great, thanks. Eugene, how, in DC, how are you all thinking about compliance issues and, you know, the ongoing issuance of guidelines?
Okay, I think the good news is that the mayor made her announcement today on phase 1 opening, and there's some guidance that either it has just hit the website or will sometime today. And the website will be coronavirus.dc.gov, and the section will be /phase 1. In thinking about some of the next steps, the two most important parties from the government will probably be our Department of Health and our DCRA, DC Consumer Regulatory Agency, that'll be responsible for enforcing the dictates that come through, the guidance that comes through phase 1. I think that we all know, you know, that there will be space requirements. The next process will be guided by proximity and density. And so, you know, I believe our DCRA and our Department of Health will have to be out and make sure that people will be in compliance. But our goal is that many businesses will have the tools and the understand what their responsibility is in providing a safe environment. So on the coronavirus.dc.gov website, there are, we have provided some guidance and some instruction over the last week or so for our restaurants and our retailers. And it provides for an operations checklist, things that people should look for, an enforcement checklist, and also a closure plan checklist that will allow any business to anticipate some of the challenges that they'll see and face them up front.
Great, thanks. Kelly, along those same lines, you know, what's going on in Maryland, and also how are you thinking about multi-jurisdiction businesses? You know, to what extent are you all working together, you know, to minimize some of the requirements where they might be different on multi-jurisdiction businesses so that they can get up to speed and running much more quickly?
Great, thanks for that. I'll just talk about enforcement, you know, real quick. And we had put together a compliance team, which again is a multi-agency team, which is very helpful in looking at providing additional interpretive guidance, et cetera. Everything from the governor's legal office to the state police, the Department of Commerce, the Department of Health, obviously. Just because there sometimes is confusion as to when an executive order comes out and how to be able to go forward and provide that guidance to the local health offices. So with that, we do have a direct line of communication with the local health officers and obviously the statewide law enforcement and the coordination centers that are involved with that. Enforcement personnel have assured us, and we have seen it, you know, happen in real time, that their first goal is to educate those businesses or those gatherings that are happening outside of the orders prior to citing any of them. All citations for violations of the governor's orders have been to those who have clearly intended, obviously, to violate the orders. And we will continue to do that to make sure that the orders are complied with in a very safe and healthy manner. We just want to keep those lines of communications open. It's very seldom that we hear anything from the local health officers or from the law enforcement entities that are involved with that. But I will say that obviously having a very diverse state with very rural counties where we've had very minimal outbreaks to those that have had some of, you know, the most distressed cases, we do see in some of those counties different types of enforcement that we at the state level we continue to address that as well. And I will say, because, you know, some businesses on the multi-jurisdiction businesses, we really are trying to be as flexible as we can. And I think that goes back to the communication with the officials in both DC and in Virginia, to be able to make sure that we're as understanding of their guidance as we are of ours in some cases, so that we can provide those very specific businesses with some good information about what they can do in order to be successful in their own economic recovery. And so that's one of the things that the Department of Commerce we work very closely with, and we have a team of individuals that work just nonstop addressing those questions on a one-on-one basis with those businesses to provide them with some additional guidance. There's a unique email address that we set up at the very beginning of the crisis, and it's secretary.commerce@maryland.gov. And we have teams of individuals, again, from multiple agencies, whether it be the Department of Labor, the Department of Health, Commerce, the state police, in order to be able to address all of those specific business questions that are out there.
Okay, great, thanks. All right, so we've run out of time. I really want to thank everybody. I do have a host of questions here that I wasn't able to get to. At some point, though, this is going to continue to evolve. So at some point, I'd like to invite you all back so we can keep this conversation going. I think that would be really helpful for people, because we will continue to learn more and adapt as we work our way through this. But anyway, Roy, thank you so much for moderating with us today. And congratulations again on your new appointment, and look forward to working with you. And Eugene, Angela, and Kelly, very much looking forward to continuing to work with all of you as well. And if there's anything that we can do to be helpful, well, please let us know. And we'll continue to put the messaging out as well, and to reinforce that, and to make sure that we can get back up to speed as quickly and safely as possible. So with that, I want to thank everybody for joining us today. Again, this will be available on our website. And tomorrow we're going to be talking with some different business leaders across the region about some of the experiences they're having as they prepare to reopen as well. So with that, thank you everyone, and have a great day.
Thank you.